Catherine Templeton. I'm the director of the South Carolina Department of Health and Environmental Control. To my left is Dr. Richard Irvin, an infectious disease specialist. He's with our agency and helping us.
Can you spell Irvin for us?
E-R-V-I-N.
Thank you.
We are in Greenwood today on the ground because there's a tuberculosis outbreak. It is important for everyone in the community to have all the proper information. This outbreak started with what we call an index. That's the first patient, the first person. And the way that that information gets to us is that a private medical doctor, somebody goes to their doctor with symptoms, and the doctor decides that there's a potential case of tuberculosis, and they notify us, the public health department. We were notified of this index in March and have been investigating and contacting people in that person's circle since then. Here's what you need to know. This person worked at a school, and immediately upon knowing that this person may have a potential case of tuberculosis, DHEC contacted the individual, and that individual has not been in the school since. Anyone who may have been infected by that individual would have been infected probably in January or February of this past year. And if you have not set foot in the 96 primary elementary school this school year, you are not at risk of being affected by this tuberculosis outbreak. Now, that is unless you have a personal relationship with the index, daughter, wife. Those people have been contacted. We've been dealing with that group of people since March. And as for the school, we have offered testing to all of the staff and the students at the school, the volunteers in the school, the people that have been in the school. We've offered testing. We've tested 463 people. Of that 463 people, 58, as of this morning, are infected or had a positive tuberculosis skin test, which means they have the germ. And of that 58, 8 people have a positive X-ray, which means they have the disease. What is important about all of those numbers is that none of them are infectious. So we still just have the one index. Dr. Irvin is here to explain the differences between a positive skin test and a positive X-ray and the infectious, but here's the one message to take away. If you haven't been at that school, you're not a close relation to that index person, who, by the way, is under a public health order and is not allowed to leave his or her home until this person is not infectious anymore, then you're not at risk.
Once someone is infected with a tuberculosis germ, it remains in our bodies for the remainder of our life. And as such, when a skin test or another form of test for tuberculosis is given to a patient, it's positive. Most individuals who have the infection will never have any problems with the germs for the rest of their life. I would like to ask you to consider the case of chickenpox and shingles. Most individuals understand that we have chickenpox as kids. The chickenpox goes away, but the virus never does. And at some time in the future, the virus can break down because of weakening the body's immunity, and then someone gets shingles. Similar sort of pathology exists with tuberculosis. Once someone is infected, the germ remains there for the rest of our lives. Fortunately, only a small percentage, 10% or less, of individuals who are infected can be expected to come down with disease later on. So therefore, we have two forms of tuberculosis infection. One is just that the individual is infected, meaning that the germ is still alive somewhere in the body, but the body's defenses are holding it in abeyance. Occasionally, the body's defenses cannot hold it in abeyance, and then those individuals come down with disease. That is specifically what happened with our index patient. He was infected at some time in the past, and then, for reasons that aren't known, he broke down with disease. The disease progressed and became very contagious. What's remarkable about this situation is not only was the index patient very contagious, but also the germ that he has been putting out there is also very virulent, or has a lot of what we call pathogenicity. not only can it cause infection, but it can also cause disease in a greater percentage of patients. This is why, to a degree, number one, we've seen over 50 individuals becoming infected under the circumstances because of the unique and rather unusual contagiousness of the patient and the patient's bacteria, and why to date we have already seen 8 cases of children who have abnormal x-rays and who are now being given therapy. What's very fortunate, there's a silver lining in all this, is that these forms of childhood tuberculosis are not communicable. They're not infectious. These children do not have any limitations on their activities. They can go everywhere they want to. They are not a public health risk to anyone else, and thereby we will treat them for approximately 6 months, and they will be cured of their infection for the most part.
So all of the 58 that tested positive and the inclusive 8 that have the infection will be treated, of course, free of charge with public health funds for the next 6 to 9 months. 6 to 9 months. And you know, we will continue as we have in the past couple of months. We'll continue with our investigation. We have yesterday. All of the tests were read, and anyone that needed a chest x-ray was given a chest x-ray. We've brought in, of course, additional medical staff to read the x-rays. You know, we've had a really quick turnaround on the school. And so, you know, we'll continue, again, with the investigation, but I think it was very important to make sure that those who are maybe falling victim to fear and confusion understand that it is okay. Unless you've gone to the school, you're not at risk.
So take me back. You found out, when did you find out that this